Welcome to How to Lose Weight and What I Eat in a Day channel. Here are some disturbing measurements about coronary episodes. Like clockwork, somebody in the United States has a cardiovascular failure. Consistently, around 805,000 Americans have cardiovascular failures, 75% of which are first-time assaults. The normal age of a first coronary failure among men is 65. Nonetheless, the most upsetting reality about respiratory failures is that numerous individuals don't find a way to secure themselves. Decreasing your danger of cardiovascular illness is the most ideal approach to prepare for coronary episodes. There are basic approaches to do this, however lamentably, numerous individuals actually don't follow them as they ought to. Here's a gander at the best different ways you can shield yourself from cardiovascular sickness, and along these lines conceivable coronary failures, and try not to be another measurement. Some cardiovascular failure side effects. Here are the fundamental indications of a coronary failure, as per the American Heart Association. Torment, pressing factor or crushing in the middle or left half of the chest that goes on for in excess of a couple of moments or disappears and returns. Feeling feeble, unsteady, or weak. You may likewise get the shakes. Agony or distress in the jaw, neck, or back. Agony or distress in one of the two arms or shoulders. Windedness. This can occur previously or during chest distress. 1. Quit smoking. Tobacco smoke contains in excess of 7,000 synthetic compounds, which, over the long run, can harm your heart and veins. Remember that regardless of whether you quit years prior, your heart well-being can in any case be in danger. It relies upon the amount you used to smoke and how sometime in the past you quit. However, it can require 10 years or more to turn around some harm to the heart, and some harm may not at any point disappear. Non-smokers are likewise in danger. Openness to used smoke can build your opportunity of getting the cardiovascular infection by 25% to 30%, as indicated by research from the FDA. In the event that you smoke, even every so often, stop at the present time. This incorporates stogies and vaping, as well. In the event that you need assistance stopping, see your essential consideration doctor. In the event that you live with a smoker, talk with the person in question about halting. 2. Lower your cholesterol. Regardless of whether you think your blood cholesterol level is okay, getting it even lower can ensure against a coronary failure. The more low-thickness lipoprotein (LDL) cholesterol you have coasting around your circulatory system, the more noteworthy the possibility that it gets saved inside your coronary supply routes. These greasy stores, called plaques, confine the bloodstream. More terrible, they can burst. At the point when a plaque breaks, it heaves synthetic substances that advance the quick development of blood coagulation, which can hinder oxygen-conveying blood from arriving at the heart muscle. The outcome is a possibly deadly coronary failure. Do this. Get your cholesterol levels checked. In a perfect world, you need your LDL blood level to be under 70 mg for each deciliter, milligram per deciliter. Yet, regardless of your level, remaining dynamic and eating a Mediterranean-style diet can drive it lower. That doesn't mean everybody with a blood level more prominent than 70 mg per deciliter needs a cholesterol bringing down statin or other medication treatment. Men that are generally safe of coronary illness frequently fine with a sound eating routine and customary exercise. Likewise, center around your fatty substance levels. Fatty substances are the most widely recognized kind of fat in the body and can be estimated with a cholesterol test. Preferably, you need a level under 150 mg per deciliter. Men with a raised fatty oil level and a high coronary failure danger may profit from a doctor-prescribed medicine called icosapent ethyl, Vascepa. 3. Deal with your pulse. About 62% of men ages 65 to 74 have hypertension. Be that as it may, most don't know about it. The most recent rules place typical circulatory strain at under 120/80ths of a millimeter of mercury (mmHg), with 120 to 129/80ths of a millimeter Hg currently viewed as raised, and 130 to 139/80ths to 89 millimeters Hg thought about high. All things considered, the objective doesn't generally mean accomplishing a particular number. Amazing is the foe of the great. On the off chance that you can't hit a careful number, it's still acceptable to be inside a nearby edge. Do this. Losing overabundance weight, following a plant-based eating routine, and embracing ordinary cardio and weight-lifting activity can assist drive with bringing down circulatory strain. Another regularly underused approach is to eliminate salt and different wellsprings of sodium. A lot of sodium in your blood makes it harder for your kidneys to eliminate the abundance of water in the body, which causes the pulse to rise. Cut back on the top pungent nourishments like bread, pizza, cold cuts, inexpensive food burgers, and sandwiches, and prepared soup. Additionally, skip seasoning dinners with table salt. All things considered, go after tasty spices and flavors, similar to basil, dill, rosemary, ginger, turmeric, and cinnamon. 4. Get your rest. Awful rest prompts awful well-being. Not getting adequate rest and battling with problematic rest issues like rest apnea and sleep deprivation raises the danger of coronary illness. Most grown-ups need at any rate 7 hours of rest. Notwithstanding, with regards to heart well-being, you need to ensure you don't rest nearly anything, or to an extreme. An examination on September 10, 2019, Journal of the American College of Cardiology found that among individuals ages 40 to 69, the individuals who rested less than 6 hours out of each night had a 20% higher danger of having a first coronary episode, contrasted with the individuals who dozed 6 with 9 hours. In any case, the individuals who dozed over 9 hours had a 34% higher danger. Do this. Get checked for rest apnea if your accomplice gripes about your wheezing, or on the off chance that you regularly feel exhausted after you awaken. On the off chance that you battle with sleep deprivation, remove any openness to blue electric lights, like from a PC, TV, telephone, or tablet, at any rate, a few hours before sleep time. Exploration has shown that blue light stifles melatonin, the chemical that directs the rest-wake cycle, more than different sorts of light do. 5. Lower your pressure. The constant pressure can expand irritation in your body, which thus can raise hypertension and lower great HDL cholesterol. Stress can have numerous sources: private matters, monetary circumstances, medical conditions, so it's vital for work at overseeing pressure consistently. Everybody has various approaches to handle pressure, such as taking up an interest or rehearsing a brain-body order, for example, yoga, qigong, jiu-jitsu, or reflection. Do this. Put aside, in any event, 1 day 7 days for self-care. When you seek after your interest, take a reflection class, or get a back rub. This custom can fortify the significance of stress alleviation and help focus on it in your everyday life. Thanks for watching. Like, subscribe and smash on the notification bell icon for future updates of my newest videos.